This is 41 Today on 41 NBC.
Good morning and welcome back. Today we have Dr. Matthew Smith joining us from Atrium. Thank you for being here today.
Well, thank you for having me.
I'm excited as we get into May. May is Stroke Awareness Month, and I want to talk about it. What do we need to know about strokes?
Well, the first thing I wanted to talk about is stroke. It's the #1 cause of disability in the United States, period. Also, it's the 5th leading cause of death. And in this area, it's particularly unique because we sit right in what we call the stroke belt, where it's a 30% higher chance of death with a stroke. And actually, we're very barely touching the belt buckle, which means it goes up to 40% chance of death, higher than the rest of the nation. So it's very important to know stroke in this area.
Is there any reason why we're seeing that here in this area?
I think it will be more of the preventable risk factors. And we can go through a lot of those. A lot of the risk factors that we need to talk about are like blood pressure. Blood pressure probably being the #1 risk factor. It's a lot higher in this area. That's something that your primary care doctor can control. Diabetes, higher in this area, which goes along with that. Also cholesterol, elevated cholesterol. And these are things that your primary doctor can check for you and get it in an arrangement. And once he takes care of those things, your risk for stroke drops. Also, in those risk factors are exercise. People who don't exercise are at higher risk, meaning a sedentary lifestyle puts you at a higher risk for stroke. Smoking puts you at a higher risk, and also being overweight.
Wow.
Alcohol, higher doses of alcohol put you at risk as well, or any illicit drugs.
Wow. And so I know you have a week dedicated to raising awareness about strokes. What is going on?
Okay, we do have a 10-day stroke challenge. It starts May 12th, because May is, of course, stroke month. But during that, you can look up information. We go out to community and teach more about stroke. And it's a 10-day challenge. Like I said, you can meet any day, just one day if you need to. But it gives you more information on stroke on how to prevent it yourself.
Okay. And so now there is an acronym to kind of detect if you might be having a stroke. What is the saying and what does the acronym stand for?
The acronym is B.E.F.A.S.T is what we use. The B stands for balance, so if there's any abnormal balance. E stands for eye movements or any eye deviation or even eye vision fields. Those all count in part of eye. Anything that you notice is abnormal with that. F is for face, so if there's a droop in the face, that's one of the recognizing factors. A is for arm. So when we say arm, we're thinking about arm drift or weakness in one side more than the other. S is for speech, which could be the ability to produce speech or the ability to understand speech or even making slurred sounds with your speech. That's for the S. And the last one is T, which is the most important, which is time. And time is the most important because we do have interventions that we could do to help you during an acute stroke. And it's very important for you to get to us within a certain time. The guidelines say within 3 hours of a stroke, we could actually give you medication for a stroke. So that's why we say time is very important, but it has to be given within a certain time period. So a lot of times I hear people say, hey, I want to see if it will go away. But I recommend that if you have any of these symptoms that you come immediately, call EMS. Don't drive to the hospital, go by EMS because it's EMS will get triaged faster. And that way we can get whatever testing we need to get done quicker.
Wow, and I do want to say, you said 3 hours max, right, to get to the doctor?
Well, 3 hours typically, that's the guidelines. We have some leeway with some different studies that we can go out to 4.5 hours. Then there's some other interventions that we can do even further.
But definitely as soon as you
But 3
notice
hours,
it.
yeah, as soon as you notice it, you need to be heading to the hospital. As soon as you notice a acute change, if it doesn't go away like immediately, you need to start heading to the hospital.
And remember that acronym B.E.F.A.S.T. If you want to find out more about this and stroke awareness, head on over to our website, 41nbc.com. Thank you so much for being here.
All right, thank you for having me.